So he's saying, hi, my name's Richard Boddy and I want to tell you about my experiences accessing healthcare.
Richard Boddy was so frustrated by the lack of interpreters available to him when he needed them most that he made this video before he died.
He's explaining there were a number of delays and in the end I gave up.
Profoundly deaf since birth and with a very limited understanding of both written and spoken English, he relied heavily on interpreters when it came to healthcare. But his family say he was completely failed by the NHS, repeatedly not provided with the translator, and it was his daughter who had to give him the dreadful news that he had cancer.
I had to suppress every emotion to be able to translate and, you know, it wasn't just at that moment, it was right the way through his treatment, right the way up until he died. We never knew when we were going to get an interpreter. And because I was translating, I wasn't retaining the information, so I was panicking when I got out, thinking, have I forgot anything? I feel like in the process I've got to be a daughter. I didn't have an opportunity to be a daughter, and I feel like cancer stole his life. But the failures of the NHS and the lack of access to that, the healthcare and the interpreters stole time from us.
Richard had been diagnosed with an aggressive cancer in his eye, but delays getting him that communication support not only affected his healthcare experience, but his family say it also impacted his outcomes.
Everywhere you went, there was a delay. Like they had to delay the operation by a week because they couldn't get interpreters, and I had to organise interpreters. And so actually, if you look at every step along that journey, there was a 1 week or 2 week delay. When you put that all together, it's a massive delay, but people don't realise.
Richard's experience is far from unusual. A new report highlights how those with hearing loss are routinely faced with a lack of interpreters when accessing healthcare, something that should be their legal right. And for many, it means they're now reluctant to even access healthcare because of the obstacles.
So many times I've been to different NHS appointments, whether it's the hospital or the GPs. I've said, hi, please can you book an interpreter? And they've said, we will, one will be booked. Many times I've gone to my appointment, they've never booked the interpreter. So it's there by myself. I'm losing more and more confidence every time. So I have to make a decision then. Do I want to carry on with the appointment, try and lip read and try and use pen and paper? But could possibly they'll get the diagnosis wrong. I might get the information wrong. I might miss some information that I'm given.
The charity RNID says urgent action is needed to stop lives being put at risk.
We'd like to see mandatory training across the NHS, really simple tips for NHS staff to be more deaf aware, such as facing somebody when they speak to them, repeating or rephrasing when needed, and also making sure they understand the accessible information standard. So about a third of NHS staff have never heard of this really vital legal standard, which means that people who are deaf or have hearing loss should access services.
I feel angry, I feel disappointed, and I feel that he was let down.
Kate says her dad spent his life campaigning for deaf rights. His last days were marred by communication battles that he should never have had to fight. Mel Barham,